Hi, welcome everybody. This is going to be our exam review for exam 2. What I would ask is that you put your name, first and last name in the chat box so that we can give you credit for being here. You don't have to put your professor if you're one of mine, but if you're somebody else's, then certainly I'll put your professor in there as well. And we'll start in just a few minutes, okay? Kim, who's your professor? Just put that in the chat so that I have it. All right. Yeah. All right, guys, welcome. What I'm going to tell you is that this is our exam review, exam 2. I'll be doing a PowerPoint with you guys. I can't share the PowerPoint with you, but I can certainly have it go over with you, and I will just listen to the wording on the PowerPoint. That's going to be important. It correlates with our study guide. What I ask is everybody put their name in the chat, okay? And we will make sure that you guys get credit. So put your name in the chat, and then we will take a look. All right, we're going to take a look at our PowerPoint. We're going to start. So first thing we're going to look at, which is important for us, is our consequences of poverty in rural areas. We know our kids are going to be our most vulnerable, our highest risk, minority and ethnic groups, single parent families, and those headed by a woman. So know that we know this with our health disparities, as our college degrees are far lower in our urban residents. What is that going to do to unemployment? Okay. And so we know that unemployment is going to be higher in our rural communities. We take a look at our migrant workers, important things to remember. We're going to see physical demands take a toll on their musculoskeletal system. Back and neck pain are going to be one of the most common types of chronic pain with these, and think about how they're bent over all the time. And that's why you will see that with them. I'm just trying to get rid of this. We look at our health risks in our rural communities. We know that they're less likely to participate in leisurely time, decrease compliance with safety precautions like wearing a seatbelt. They don't engage in their preventative health screening, so we're going to see more disease prevalence that's chronic. Clients who live in rural communities are going to know each other very well. We talked about making sure that we know that there's a lack of expression on drug use, sexual assault, or depression because they're always afraid that other people will find out about it. With our farm workers, we think about pesticides and what we're going to do for that. So our primary intervention would be to provide education and teach workers how to reduce their exposure. We can do hand washing stations and screening, such as urine testing for pesticides. And we can initiate treatment for symptoms of pesticide exposure, such as nausea, vomiting, and a skin irritation as our tertiary level. I'm going to repeat myself again. We see more chronic disease, more prevalent in our rural community, less likely to participate in leisurely activities. And to remember that in our rural communities. Culturally, our Mexican population, I would like you to know. So we know that nurses are considered an authority figure, generally speaking, so that you want to be able to relate to them and maintain their dignity. They really like it when you do some chit chat with them. Touching is a caring gesture and is seen as something that is okay to do with our Mexican cultures. Which takes us into our vulnerable population of homeless. Single motherhood is increasing. We know there's a direct relationship between education and poverty. So Our poor teens are 3 times more likely to drop out of school as their non-poor parts. So we're going to have programs that are going to help our mothers complete our education, chances for a better future. Important to keep our pregnant adolescents in school during the pregnancy and have them return as soon as possible for this. Okay, so make sure you know that with our fastest growing segment is families with children among our homeless. Okay. When we look at our homeless access to health care, we know homeless people have the same problem accessing care as to poverty. So we're going to see that they're in the ERs to get their care, and the cost of service is high, but is going to be not refused as it may be in a clinic. Okay. So I did some pictures for you guys just so that we know. We look at vulnerable populations. HIV is transmitted through our intimate sexual contact, exchange of bodily fluids. Who's at our high risk? Individuals who have used IV drugs, individuals with persistent recurrent sexually transmitted infections, individuals who have multiple sex partners. With our adolescent population, please know that we're working at creating a culture where we see coalitions working against violence in our communities. So we're increasing our social skills. When we do that increase in social skills, how they all communicate, we are seeing a decrease in violence. So they're very related. With our alcohol, drugs, and tobacco, we know that it's a concern. What kind of drugs do we not want to mix with alcohol?
Other depressants.
Which one?
I said other depressants.
Opiates.
Yeah, any of those ones that are going to suppress the nervous system, right? We don't want to mix that with alcohol because what ends up happening is that it suppresses everything. So we're going to teach them about that, right? I'm sorry, just give me 1 second, guys. Okay. What kind of discharge would you teaching? Avoid alcohol with those kind of phenobarbital, those kind of ones. We know that psychological dependence with chronic use, we know it comes from risk factors related to violence, trauma, genetic connections, and mental illness. When we're looking at this population, our behavior risk survey is going to be what we use for screening purposes. Secondary prevention there. With our primary prevention, concerns with tobacco and its objectives, we look at providing community education to teach healthy lifestyle. Secondary, we're going to institute early detection programs in schools, drug screenings, and tertiary prevention. We're going to develop programs to help people that have already had that substance abuse. Nicotine ingredients, know our dangers and how a community nurse is going to teach parents that our vape oils are poisonous. So if they say just vape, we're going to make sure we tell them that that is not a safe thing to have around children. We looked at parish nursing in the past couple of weeks. We had 2 different types. Congregational is going to be focusing on a specific congregation. So you're going to take care of one large group all on your own. So you're going to have a lot of autonomy there. And then with institutional, you're going to have a liaison between the church and other people. So we're going to have help when we care for community with outside. So congregational is going to be much more individually driven, where institutional is much more involving the institutions and having more people involved. 2 definitions, religiosity and spirituality. Religiosity is going to be a person's health, beliefs, and behaviors that are with a specific religion. And spirituality is an individual's attitude and beliefs related to God or non-material forces of life and nature. So both of those I want you to know definitionally. With our parish nurse, we have primary prevention. We can hold classes with youth and parents on healthy eating. We can encourage a variety of activities. We can do proactive in school parenting counseling. We can do our secondary prevention with weight screenings and our tertiary with weight reduction support groups. We look at our care plans and ADPI, and we remember that steering the conversation towards goals, the nurse is now able to work with the client to mutually identify our outcomes. That's what you want them to be, mutually identified, Discussing health problems and limitations, the nurse was gathering a history as part of our assessment, and this allows for us to form a nursing diagnosis. The planning would occur after the outcomes have been identified, so the plan can be established and our outcomes can be met. So think of our ADPI when we're planning our goals and assessment. Know the difference between Medicare and Medicaid. So with Medicare, we know that the client must demonstrate a need for nursing skills. So the nursing skills must be considered skilled. So services like sitter services, assisted with activities of daily living, are not going to be reimbursed with Medicare. Medicare, we know, is for those 65 and over. It's a federal insurance program. Medicaid, though, is a federally funded state assistant program. So we have state with our Medicaid. Again, I re-emphasize Medicare will only pay for homebound health care by professional skilled nurses, not life skills. No, our physicians are going to accept a client, may not accept a client on Medicare or Medicaid because of their low reimbursement. Just a little graph there. What's our primary goal of hospice care? Our quality care and comfort, but during our processing, our death and dying process. We have 4 different organizations. We have OSHA, which is going to be our one that creates and enforces regulation in a safe environment in a workplace. We have the Department of Transportation. We have our National Institute for Occupational Safety and Health, and that's going to be our research and education for our occupational nursing. So please know the difference between OSHA and our National Institute for Occupational Safety and Health. Epidemiology, we know, is the study of and distribution of factors that determine health-related states or events. We have analytical, where we analyze, we look at the origins or the causes. For example, how does it occur, and why are some people more affected than others? We have our epidemiological triangle. Please know your 3 parts: your host, your agent, and your environment. We know that we have our different levels of prevention, and we know that agents can attack based on environment or host. They are all interchangeable, though, so you know that you need all 3 of them involved when we're doing our epidemiology. Here's another example of the triangle that I showed in class tonight. Know that our host can be age, sex, genetic profile. Environment can be temperature, altitude, crowding, housing. Agent can be biological, bacterial, physical trauma, and nutrition. When we look at our healthy people 2030, we're going to make sure we're eliminating elevated blood levels. We're going to reduce pesticide exposure. We're going to reduce the number of toxic pollutants and our allergen levels. People with immune deficiencies are going to be at higher risk for these environmental health impacts. Case fatality rate we're going to look at with epidemiology. It's going to be the proportion of persons diagnosed with a particular disorder who die within a specific period. So that will be an estimate for death within that period for a person with a diagnosis. Therefore, you may have someone say, how long do I have to live? And so that's our probability of surviving. So that's our CFR, cause fatality rate. I spoke to this, but I'm going to re-emphasize our individuals with immune deficiencies are at higher risk after consuming contaminated foods and waters. So know that they are more vulnerable. Reuse, reduce, and recycle are 3 R's for environmental health. We're going to take a look at different types of studies. And that is going to be our ecological, which is going to be quick, uses data that we already know. So we're going to look at characteristics such as population rates rather than data's exposure and things like that. So aggregate data where we're going to have a further investigation or suggest new hypotheses. Cross-sectional is where we're going to look at a description of the scope of the problem. And we're going to look at prevalence estimates. So it's a cross-section or a population of a group collected on current health status. There's a simultaneous collection of information necessary for exposure. We have our retrospective, so think of retro as back. These studies are going to rely on existing records, employment, insurance, and hospital records. So example of asthma cases is monitored through number of visits to the school nurse over 5 years. We did occupational nursing, and that is going to be specialty practice that focuses on our prevention of healthcare, promotion, and restoration in a safe, healthy environment. We see working in manufacturing industry, healthcare, construction, and government settings. And that is my pieces that I'm going to cover on my PowerPoint. So I covered it relatively quickly. I do know that. But are there any questions on the study guide that I can guide you with? All right, here, I'm going to throw out a couple questions for you. Who's at highest risk in our rural population? What group of people?
Children?
Yep. And what are we going to worry about with our rural healthcare, with our rural workers? What kind of things are we going to look for?
Pesticide poisoning,
Okay, what else? What body system are we going to look at because of what they do every day?
respiratory,
Mm,
Muscular and skeletal.
their
yeah, focus
Yeah,
on your
their backs.
musculoskeletal in them. Okay, you're going to focus on musculoskeletal on the population. Who's going to be at high risk for HIV? We went through this. Teens. What are they going to be? Who's going to be at risk? What are their risk factors?
Multiple sexual partners.
What?
needle users,
Needle users. What else?
You said multiple sexual partners earlier, is what I was saying.
Yep, I sure did. Thank you. What else did I say? We're going to see the presence of what among them? How about our STDs, right? They're going to have increased STD rates. Yes? The more
Yes.
partners, the more risk, right? What are we going to focus on our pregnant teens?
Making sure they go back to school.
Education. Right? We need those people, we need our teens educated. We know the relationship between poverty and lack of education, don't we? Yes, we know this. All right, let's see. For violence among our youth community, what kind of things are we going to teach them that's going to help reduce that violence?
Increase social skills?
Very good, Jenny. That's exactly what I want you to focus on. Where do we see our homeless getting their care?
hospitals, ER,
Yeah, so what do we know about the cost of care on our homeless population? Is it high or is it low?
Hi.
Yeah, it's high cost because they're going to the ERs, right? What do you know about vapes?
Poison?
Poison for kids. How about what is that survey we're going to use with our addicted communities? It's 3 words, a blank blank survey.
Windshield survey.
No, a windshield survey. Good guess, though. That is a type of survey. And windshield, I'll give you the 3 words. Remember our behavioral risk survey? That's what we're going to be looking at with our addicted communities because we're assessing, we're looking at what are they doing behaviorally that's going to put them in that problem, right? All right, we take a look at who's going to be vulnerable for alcohol, drug, and tobacco addiction. Everybody's quiet. What about genetics? We know, right? That's genetically driven. What people who are treated poorly, they're a victim of violence. We know trauma causes addiction, and we know that mental disorders causes addiction, right? So we got a lot going on there. What's a tertiary prevention that a parish nurse could do?
Teach them like the case study that we did in our class. If they give, are you talking about like for drug addiction or just with any?
In general, with a parish nurse.
So like we did our case study in class yesterday, where they got sick from not preparing food correctly. So since it's already happened, teach them how to prevent that from happening.
Yeah, remember we're gonna do support groups is a big one for tertiary prevention, right? Getting everybody together so they have each other to help with that. It's another good one that we have. What could we do for primary prevention for a nurse for obesity? What are some things we could do for primary prevention?
Teach them about diet
Eat
and exercise.
and exercise. Yeah.
Making sure that good food is available, right? Wherever they're located. We have the Agency for Healthcare Research and Quality, which we know does what? What's our Agency for Healthcare Research and Quality is going to do what? What do you think? What's it going to regulate?
Quality of healthcare.
Exactly. It's research and quality and healthcare. Good. Please know examples of host, environment, and agent. Remember when we're doing our epidemiology, we're looking at our prevalence of illness among the communities, and what does that do? That can speak monuments to changes in the community among our community members, our health boards, all that kind of stuff. All right, remember secondary insurance, we're always going to have our screenings. We're always going to look for that word screening. With our outcome identification with our patients, we're going to make sure that we do that together. They're part of it. What needs to be the case in order for Medicare to cover home services?
Nurse skills.
Good.
Instead of living skills.
Yeah, what's an example of a nurse skill?
Like dressing changes and wounds and stuff.
Yeah, wounds, dressing changes.
Insulin injections.
Yeah, they probably won't reimburse for somebody to come do that, but. All right, what do we know about Medicaid? Is it as strict as Medicare? No, our emphasis is
No.
going to be on our Medicare is pretty strict on our home visits. Medicaid may be a little more flexible. Okay, know that in order for who's Medicare and Medicaid funded by?
Medicaid by the state.
No, they're both funded by the federal.
Federal government.
You're on the right page, Jenny.
Federal.
They're both federal, but who
Medicaid's
administers?
both.
Like who keeps track of it? Right?
The
Is it-
state for the
Yes.
Medicaid. Yes.
Yeah, exactly. Good. So you're right. You got it. You know, but just remember they're both federally funded, but our state is going to administer our Medicaids. And we talked in my class about how Medicaid is called something different in every state. That's how you remember that one, right? Okay. What else can I go over with you guys? I'm just trying to review so I make sure we have everything. What's our focus of hospice care?
Comfort.
Comfort care.
Right. Comfort care during our palliative phase, right? And then we have two different models of nursing as our parish nursing, congregational, institutional. Which one is going to be more independently run?
Congregational.
Good, Faith, good. Congregational. And because with our institutional, we have a lot of other people involved, right? Let's see what else I can ask you. Know about implementation as a nurse. What does that mean? What does that look like? When you're implementing something, we came up with implementation today in class, so that was helpful. What do we know about tobacco smoking?
Put you at risk for,
Or
or increased risk for comorbidities.
cancer.
Yep, it's causes more deaths than any behavior in the US.
Hmm.
Okay, something we may not know, and because of all those comorbidities, right? What's the fastest growing group of homeless? Families with kids is our biggest growing, fastest growing, right? Let's see. We're gonna make sure with our migrant workers, we're teaching them how to avoid pesticides the best we can. There's several different things we went over, primary, secondary, tertiary. Our goal is really to prevent the exposure there. We're working with Mexicans. What do they like?
Touch.
Yep, what else? Remember the little conversation, like the chit chat, like getting to know each other, getting to know you before you do something. So they want to like talk to you a little bit, okay? Know your primary, secondary, and tertiary. There's about 4 questions on that. Case fatality rate is going to be, what chance do I have to survive? That kind of question will help with case fatality, remember, because it's the rate of death of a certain thing. I will repeat to you, you need to know host, agent, and environment. You need to understand what we're going to do. One thing I didn't cover in my PowerPoint is the World Health Organization. This is on your study guide, I do believe. If it is not, I want you to know what are the roles of the World Health Organization. We look at drug reactions, we look at vaccines, we look at biomedical research, we look at international diseases, and we look at public health initiatives between our countries, because remember, it's World Health Organization. So World Health Organization is going to do a ton, right? Looking at the whole world here. What's the mission of OSHA? What's the goal of OSHA?
Health and safety of employees.
Yeah, and working. Yep, in workplaces. Good. Who's going to get sickest from the contaminated water?
Kids and elderly and immunocompromised.
Immunocompromised. Focus on immunocompromised for that, okay? Reduce, reuse, recycle. We know that as our environmental nurses that we are. Please know that's what we use. It's good all across the board. So remember our 3 R's. Reduce, reuse, recycle. When we're looking at our older people in the homes, just as a review, what are we going to make sure is working in the kitchen?
Smoke detector.
Fire alarm.
What old people will sometimes not pay attention to, or may not be able to see it, or might not be able to feel it. How about our fridges? Making sure they're working so the food doesn't go bad, right? Gonna be something we emphasize with our older population. Because sometimes they don't look at expirations. I don't know about you, but my parents used to have all kinds of things in the house that were spices that were expired for like 3 years. They just didn't even look at them. So just think about that. The older, our older clients may not be able to see good. And if they're, in a situation where they don't have glasses, it's gonna be hard for them to look at expiration dates. And they have a lot going on, in their older life, and their bodies are acting all funny. Okay, any questions at all? You'll have 5 math problems, I will tell you that. Review. I'll let you know. You guys know a ton right now. I want you to focus on the study guide, please. Of course, you're always doing all your reading, and you guys are very diligent about it. I know you are, but we're really focusing on our on our study guides, because there's so much content, right? This is gonna help you, oopsie, this will help you on your, let's see. I'm just copying in the chat. I hope everybody put their name and professor in the chat, because I'm now going to send this to all of our other faculty so they know who came. Good. Any questions, guys? I will be posting this for my class. Okay. And I'll send it out to everybody's professors, so you guys should all get a copy. Any last minute questions?
Okay.
No? You guys are quiet. Oh, you're welcome. You guys are so quiet. It's probably because half of these people were in my class, so they've had to listen to me for an hour and a half now. Oh, now almost 2 hours. That would make me tired too. All right, guys, study hard. Any questions you have, I'm available on the Fortis email, so you can send me a question if you have it. I'll be posting this as a YouTube attachment in my announcements, and best of luck to everybody. You got this. We're halfway there, okay?
I have one question. Where is the study guide you posted?
Under your announcements.
Oh, announcement, okay.
Yeah. There's an announcement that says, here's the study guide and here's the class, whatever. It's a class review or exam review.
Okay, okay. It's good,
See it?
thank you.
You see
Oh,
it?
yeah, I got it.
Okay, so print that out and go over that. A lot of what we went over tonight in our PowerPoint is on your study guide.
Oh, okay.
Okay. All right, good night, everyone. Best of
Thank
luck
you.
studying.
Good night. Thank you.
You're welcome. You're welcome.